73-year-old Richard Victor is an avid golfer.
Well, I started when I was 10, 12 years old. My dad taught me my first lessons and took me out in the course and patiently taught me how to play. I've been playing ever since. I've been playing golf for 60 years.
He loves it. He enjoys it. I get my time. And on our second date, he showed me how to swing a club, and I play with him every once in a while.
Traveling is a favorite pastime too, especially for monumental milestones.
Well, my wife and I are celebrating our 50th wedding anniversary. So to do something real special, we decided to do basically a 2-week cruise. We're going to be going to Athens first and spending a couple days in Athens. And then we get on the ship, and from there we go to Turkey.
At one point, their 50th wedding anniversary trip was in question. Doctors had been following Richard's PSA numbers. It became a concern earlier this year when the level reached 9.
At that point, the urologist recommended that we get an MRI of the prostate and most likely a biopsy, just to make sure there's no cancer present, or to find out if there is cancer present. And the MRI showed a little tumor on my prostate.
The next step was a biopsy.
The results came back in the next couple of days. And in fact, the results showed that there was cancer present. But it was located just in that area of the prostate where the tumor was.
It's hard to hear that diagnosis, and even though people were saying it grows slowly, it still weighs on you because you don't know what direction to go.
Once I got the diagnosis, I began to reach out to other people who may have had to go through what I was going through in terms of trying to figure out what the next steps are going to be.
Radiation or surgery seemed to be the only two options until Richard and Louise met with the chair of urology at Penn State Health, Dr. J. Raman.
He was really trying to figure out and determine what would be, for him, the best treatment option, in discussion with both his healthcare providers, but also his wife and his family.
As we talked to Dr. Raman, he said to us, based on the size of your tumor and its location and all your other symptoms, you'd be perfect for this new therapy called HIFU, high intensity focused ultrasound.
It basically involves using high frequency ultrasound technology to kill tissue through thermal heating. And the whole concept behind it is like a magnifying glass, using a lens to focus energy to kill tissue without having to remove it and take it out.
And all of a sudden there was this other option. And it was like the weight of the world just fell off our shoulders when he explained that.
It just felt right. It gave us the option we were looking for. Not as severe an option.
So in Richard's case, this was very appealing because it allowed us to treat his area of cancer. It allowed it to be performed without a major operation.
Dr. Raman called me when it was done and just said how amazingly well it went.
So well, Richard watched his favorite sport after the procedure.
When I woke up, the PGA golf tournament was on. So I just woke up and watched the golf tournament, and the folks at Penn State Hershey were wonderful.
A week later, Richard was swinging golf clubs and confirming reservations for their golden anniversary trip.
We feel physically ready to go. There's going to be a lot of walking and climbing steps and things like that. And he's just really back to normal.
We're feeling just very confident that we can do what we normally do when we're traveling without having to worry about anything else beyond just enjoying each other's company and enjoying the travels.
Now, Richard was the second patient at Penn State Health to have this procedure. Since that time, more than 20 patients have been treated with HIFU. And joining us is Dr. J. Raman, chair of the Department of Urology at Penn State Health. What a great story.
Yeah, really exciting. I feel like that's what it's all about. I feel like being able to offer new technology to patients such as Richard, really giving them maybe options that we didn't have a year or 2 years ago.
And you are the only facility in this area that does HIFU.
We are, and that's part of been our goal in all of this, which is trying to offer the full spectrum of treatments to patients, whether that be surveillance, surgery, radiation, hormone therapy, or in this case, HIFU, a less invasive option to treat tumors.
And speaking of less invasive, how do these minimally invasive options or procedures really benefit the patient?
Well, I think fundamentally it's really important that we tailor what we offer patients based upon a few characteristics, their goals and the type of cancer that they have. And as Richard pointed out in his story, through MRI and other diagnostics, we can identify not only does a patient have prostate cancer, but where in the prostate they have this cancer. And that really affords us the opportunity for these minimally invasive treatments where we can target a single area in the prostate, deliver energy in a non-invasive way, and therefore preserve quality of life.